The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard on every Wednesday at 4 p.m. on 103.9 LA News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. If you wait, it may be too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Please welcome my co-host, Sammy Vanny.
Hello, how are you, Dr. O'Brien?
All right, how are you today?
Good. It's warm out today, finally.
It's beautiful, right?
It is. I feel like when the sun comes out, everybody just has like this weird energy.
Yeah, well, we need that. You know, we're sun worshippers. You know, I mean, it's all about, people don't realize the, conversion of vitamin D from inactive to active form through your skin with sunlight. So we need that.
Yeah, I definitely needed it. I feel like I was in hibernation mode. Now I'm coming out.
That's right. It's going to be bikini weather. All right. So how's school going?
It's going good. It's almost over. We were talking about how we have like 3 weeks left. I was like, oh no.
Yeah, 3 weeks.
I was like, no.
I remember those days. All right. Last week I was talking about nutrition, and we're going to follow up today with Semaglutide, the weight loss injection medicine. I announced last week that I'm going to be prescribing this medication. So today's show, we're going to educate you on the medication itself.
So for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with a personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we do have a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
All right. Again, today's show, Semaglutide, the weight loss injection medication. This is the hottest item out there for weight loss. And now let's start educating the community on it.
All right. So can you tell us what is semaglutide?
All right. Yes. Semaglutide is a G1P-1 agonist, which is an injectable medication. It's also known as Wegovy, okay, and Ozempic. And everyone knows the name Ozempic. Or there's an oral form, it's called Rybelsus, okay? Rybelsus. These are tough words here. This medication was initially developed to treat type 2 diabetes, okay? Type 2 diabetes. The medications lower blood sugar levels and reduces the risk for macro and microvascular pathology. I've said that almost every show that we talk about diabetes, high cholesterol, eating simple sugars and neuropathies, talking about macro and microvascular pathology. We want to reduce the risk. This is one of those medications. Studies have shown that type 2 diabetics injecting semaglutide weekly demonstrated a significant amount of weight loss. Therefore, physicians started prescribing this medication off-label for weight loss.
How does it work?
All right. So, semaglutide works by increasing insulin release. All right, so basically we're going to tickle the pancreas, okay, which is going to be the beta cells. We're going to tickle the beta cells in the pancreas, and we're going to ask them release more insulin. So it's releasing more insulin, and it lowers the amount of glucagon released as well. It delays gastric emptying, okay, and reduces appetite. So if we slow the gastric dump, okay, meaning the food bolus that's in the stomach, it stretches the stomach and it gives us the sensation that we're full. If we keep that sensation there, we're going to naturally eat less, and that's why we do that. Part of hunger is you have the physiological hunger and then the psychological. All right. Well, what's physiological and psychological? Well, physiological is the actual feeling sensation that you're hungry, and you get that burning and you hear the gurgling in your stomach. You're going, oh boy, I'm getting hungry. And that's the gastric juices being secreted by the chief cells in the stomach. The psychological, all right, that's when we're looking at the clock saying, okay, it's 12 p.m., it's time for lunch, it's lunchtime, therefore I'm hungry, let's eat, all right? So what we would like to do is we want to delay gastric emptying, and which will help stimulate the sensation that we're full, and it reduces appetite. The key is reduce that sensation that we're full and we're not hungry.
I know a lot of people say that weight loss medicine isn't safe. So what makes this safe?
Right. Well, there's all different types of medications out there. So we'll start off with, we have the oral medication. Those are the phentermines. In the 1990s, we had what was called fen-phen. All right, so it's F-E-N versus P-H-E-N, fen-phen. Did it work? Yes, it did. However, they found the medication fen with F-E-N, patients lost weight, but they also developed pulmonary hypertension, and that's dangerous and is very hard to treat, okay? So we use phentermine, that's PH, because that's still on the market, and that is a medication that helps speed up your metabolism. Safe, yes, but you have to be medically cleared by your doctor to make sure you qualify for this medication. What we're doing is we're speeding up the metabolism, so we have to make sure your heart is stable. You should do an EKG. You want to also do blood work, get a nice baseline, and you can start the medication. I tell my patients, if they're able to take it every other day, then you take it every other day. Why? Because we develop a resistance or tolerance to it. And it won't work. And this is only for a short stay, meaning for only like maybe 3 months. It's not for long-term use. It's a short-term use because we develop a resistance or tolerance to it. Then we have medication Topamax, and that's a medication that was used, and it works in the brain. And if you use a combination with the phentermine and the Topamax, you can lose weight as well. But again, it's medications. What do we say in pharmacology? All drugs are poisons. We just control the poison for a specific function. And we do not want to go into the toxic range because then it increases their side effect profile. So is it safe? Yes, but you need to track it and monitor your patients. You have to know your patients. One pill's good. So if I take two pills are better than one. No, that's not the proper way to do things, but people will think that. Always diet modification. Okay, you go in a high fiber diet, a low glycemic index diet, but the most important thing is the will. How bad do you want it? Okay, again, an exercise program, an aerobic program, and then be medically cleared by your doctor to do all this. Weight, diet, behavioral modification, and exercise program. Is it safe? Yes, but still, you have to be medically cleared. Now, is semaglutide safe? Yes, the medication is safe. However, all medications, there are contraindications, such as an endocrine neoplasm, family history of thyroid cancer, diabetic ketoacidosis, pancreatitis, kidney disease, diabetic associated eye pathology, that's your neuropathies in the eye there, or we call retinopathy, pregnancy or breastfeeding, okay? These, what I just mentioned, it's contraindicated to have this medication. So if you're thinking about getting pregnant, you have to be off this medication it's suggested for at least 2 months before you get pregnant. If you are pregnant, you can't have this medication because we don't want to be losing weight while you're pregnant. We need to gain weight so the fetus is given nutrition, right? That's why you're eating. I always say you're eating for two. All right. So again, like I said, if you're planning on getting pregnant, you have to stop at least 2 months before.
Okay, so how is semaglutide taken?
Yes. So what we'll do is we have a minute. I'll stop with this question, then we'll pick it up and we'll go over other things. How is semaglutide taken? Well, semaglutide, Wegovy, and Ozempic are weekly injectable medications, and there's a starting dose that is titrated up every 4 weeks until the maximum dose is attained. And then you go into a maintenance phase. Rybelsus is an oral medication that is taken daily. All right, so we're down to the last 30 seconds. You want to say anything? Say hi to Mom.
Hi, Mama. How are you?
All right. All right. It's a beautiful day out there. I hope everyone's enjoying today. Sunny. It's warm. I don't know. Got to be, what, in the 70s, you think?
I think it's in the 70s,
70s, yeah.
It's supposed to get to like 80 tomorrow.
Wow. All right. To learn more about my practice, go to drtomio.com. That's drtomio.com. Or give my office a call, 631-980-8200. I am now offering semaglutide, weight loss injection to my patients. So you're looking to lose weight? Give my office a call. Welcome back to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LA News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. I'm here with Sammy Vanny, my co-host. How are you?
Hello. I'm good.
You doing all right?
Yeah.
You having a good time?
Always so much fun with you, Dr. O'Brien.
There you go. All right. So we got 3 more weeks and school's over. You have plans for the summer?
I'm trying to work now, work a lot so that I don't have to do it during the summer because I want to go away.
You want to go? Where do you want to go?
I have no idea, but I need to get out of here.
You want to get out of here?
Yeah.
As long as you're not going crazy, you're okay.
Shh, don't tell my mom.
There you go. All right. So today's show, we were talking about semaglutide, the weight loss injection medications, the latest craze. Over the break, a point was brought up. I use terms, micro, macro, pathology, and I want to let's bring that down a little bit. In the past shows, I've mentioned that. So what are we talking about? We're talking about small and large pathology in the arteries, talking about hardening of the arteries or arterial sclerosis in the arteries. The studies have demonstrated that semaglutide reduced the risk for heart disease, heart issues, okay? Because what are we talking about? Hardening of the arteries, coronary artery disease, where the arteries that surround and supply the heart with blood, nutrition, and oxygen, they start to harden up. Well, this reduces the risk. Why? It is lowering your blood sugar levels. All right, so let's continue. Now, I left off with, we discussed what is semaglutide. I know it's a tough word to say. And then we went over how does it work. Let's go over that one more time. It works by increasing insulin release. Well, what does insulin do? Insulin, it's produced by the beta cells in the pancreas, okay? The pancreas, it's monitoring the blood, okay, the blood sugar levels. The beta cells pump out insulin, and the insulin drives sugar into the cells. So what we're doing is we're tickling the pancreas to produce more insulin, okay? So we can drive more sugar in, and the body can start to utilize and burn up those, the sugar instead of storing it, okay? So it also lowers the amount of glucagon released. It delays gastric emptying, all right? So that means the food will stay in the stomach a little bit longer. The stomach stretches, and then the nerves that surround the stomach start to fire, and it sends a signal to the brain, wait, you're full. You do not need to eat anymore, okay? So, and then this helps reduce appetite, and that's how the medication works. Is it safe? Yes, but like all medications, what do we say? All drugs are poisons. We just control the poison for a specific function. So you need to be careful. You need to choose, the patients that qualify for this medication. I know there's a lot of online services, but you're just filling out a questionnaire. Are you being examined by a doctor? No.
No.
No. It's just a doctor or physician assistant or nurse practitioner filling out a questionnaire, and they get on 15-minute phone call, and yes, you qualified. Well, it's based on what you tell them. It's subjective. So if I hide information, they're making decisions based on what you're filling out on a form.
People just want to take the easier way out, especially with weight loss. They just want it to happen quickly.
Yes. Well, you got to be like I said, you have to be very careful. You want to be honest with your physician, because we're making decisions based on what you tell us. Again, if you're thinking about becoming pregnant, or if you are pregnant, or you even lactating, you're breastfeeding, this is not for you. Okay, you have to wait until you complete the pregnancy, or you're no longer lactating, and then we could start the program. All right, so we left off with how is semaglutide taken? It is taken either weekly, an injection, okay, and it's titrated up, or you can have a oral medication that's taking every single day.
So with the doses, what would the dose be for semaglutide?
Yes. Okay. All right. So for Ozempic, okay, I'm going to just use the name because people are hearing the names. Ozempic, it's an injection. Weeks 1 through 4, you're going to take 0.25 milligrams a weekly dose. So for 4 weeks in a row, you're going to inject 0.25 milligrams. Week 5 through 9, we're going to double the dose, and that's going to go, it'll be 0.5 milligrams weekly. Week 10 through 14, we're going to double the dose again, and it's 1 milligram each week. And then weeks 14 onward, in what we call the maintenance phase, you're going to double it again, and it's going to be 2 milligrams every week. All right, so we're doubling it. Now, this is the suggested. Now, I know there's people out there that will push it. Instead of being 4 weeks, they'll, every 2 weeks. But this is what the literature says. It should be slow titration, right? Start low, go slow. And if there's any reactions, we're able to stop the medication. We don't want to push too hard. You have some time. This is not going to be overnight. It's going to be 3, 4, 5 months, and that's when you're going to start seeing that weight loss. How much weight loss? I've seen studies that are suggesting anywhere from 20 to 40 pounds over 3 to 4 months. Now, will you have that? I don't know. Okay, you'll have to start the medication to see how your body reacts to it. All right, next we have Wegovy, and that's an injection also. This one's a little bit different. Weeks 1 through 4, it's 0.25 milligrams. That's the starting dose, and that's each week. Weeks 5 through 8, it's you're going to double it, 0.5 milligrams weekly. Weeks 9 through 12, you're going to double it again. It's going to be 1 milligram weekly. Weeks 13 through 16, this is where it's different. It's going to be 1.7 milligrams each week. And then weeks 17 onward, or week 17 onward, it's going to be doubled 2.4 milligrams weekly, and until your desired weight, and then you go into a maintenance. Rybelsus, okay, this is the oral, and weeks 1 through 4, it's going to be 3 milligram dose. That's oral, okay? Weeks 5 through 9, 7 milligrams. We're going to a little bit more than double. A 7 milligram dose daily. Weeks 10 onward, and we double that, and it's going to be 14 milligram dose daily. Well, again, start low, go slow. Very, very controlled. We want to control this. So if there's any side effects, we can back off and we can stop the medication. So it's called titration. We're slowly titrating upward on the dosage. You double it after 4 weeks. Every month, we're going to double the medication. How much weight loss? As I just said, the weight loss can be anywhere between 20 to 40 pounds, depending on your genetics, depending on your diet, depending on how serious you are, about exercise and looking at this from a holistic approach.
What shouldn't semaglutide be taken with?
Yes. Okay. Insulin. So if you're type 1 diabetic and you're taking insulin, not able to have this, okay? Because we'll have issues with driving the insulin. Remember, with type 1 diabetes, the pancreas, the beta cells may or may not be producing insulin. If it is producing insulin, it's very, very little. Typically, there's no insulin being produced, and that's why we're, injecting exogenous insulin. So you don't want to, inject something into the body that's trying to tell a cell that's not producing to produce something. It's no good. If you're on Byetta, Trulicity, Victoza, and other G1P-1 agonists, we cannot double that. That's a no-no. If you have eye issues, like I said, a retinopathy that is directly related to diabetes, you're pregnant, you're breastfeeding, or you think about pregnant, you do not want to take this medication. All right, so hopefully we educated the community on this medication. I will be offering this service to my patients now. So if you're looking to lose weight, you want to try the injectable, give my office a call. I will be prescribing that. I will teach you how to use the medication, and we'll come up with a nice nutrition program and exercise program. We'll shed those pounds. Summertime's here. All right.
All right, for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with the personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we've had a lot of interest. We encourage you to call the office today and schedule your appointment. We look forward to serving you.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.